Minuteman. Tonight we're going to be looking at my med bag. It has a couple of uses really that we can build this for. If you have a team, it would be a team support bag, which basically if you have anybody that's in the medical field, that would be their bag that they would take with them on a mission, and then the rest of the team would be able to support them, with protection, whatever needs to be there. That's just something you'd have to work out with your team. You can use it for natural disasters and general medical support for everyday life. My experiences within the medical field are mainly on the military and security side. Mostly I learned everything back in the day for medical out of the soldier's common task. How to put on a pressure bandage, how to make a tourniquet, how to prevent shock, evaluate casualty, things like that. That's all in this book. It's STP 21-1-SMCT if you're able to find one. Now this revision was October 1994, so that's a little out there and kind of dates me a little bit. But I was also a combat lifesaver over in Iraq. Fortunately for me, I didn't have to attend to anybody that was really in trauma. But I was prepared for it. I had a little med kit that I could grab and go if I needed to. It just happened to be that nothing ever really happened around big enough where I was at. I mean, it was we got mortars and stuff like that, but nobody got hurt, nobody got anyway, so I didn't have to do anything other than band-aids and stuff like that, which most of the guys had their own stuff anyway, so it wasn't that big a deal as far as a combat lifesaver. Now, for practical stuff that I have done, I've treated a head wound, prevented shock at a wreck. Of course, the guy was pretty messed up, so who knows whether what I was doing was helping or not, because he was, all jittery. I have evaluated patients and assessed their injuries and things like that before the EMTs arrived, and was able to give them the vitals, not vitals, but the vital information. Their name, age, can they respond to questions, things like that. Just kind of helps the EMTs out a little bit. And then one night, I was at a place and a guy got pistol whipped, and his left eye was bulging out. He had a nice little cut right through here, and his left eye was bulging out, and I didn't have anything that I was able to do other than just kind of stabilize him and keep his head from moving in case he had a neck injury, because he was complaining about his neck and all that stuff. So I just basically was there for 15, 20 minutes before the EMTs arrived. So that was one night that was interesting. Okay, outside of that, the next thing I'd like to move into is everybody wants tourniquets. Great, fine. I'm just going to say, don't make the mistake that I did. I bought 3 tourniquets. I'm going to claim ignorance here, but I didn't know that there was actually, you know, some fake ones out there that you could get a hold of. So I bought 3, bought them in a little package deal, and they're actually, once I found out, they are actually fake. And I'll show you what to look for on the fake ones. And you can usually see it on the pictures that they show if they're fake or not. Now, I got these off of Amazon. Try and get this in here, but if you look, see all these little dots right here? That's way too many dots. Usually, if it's not fake, there's not going to be a dot in that center portion. Hopefully you can see that, and it'll come out good in the video. But there's usually not a dot right there, and there won't be as many dots on that red strip. So these are going to be just for training. And the reason why you don't want to use these, unless you want to take that chance, I don't really want to, but I want to train. So I've got these for training. Once you start tightening it down, it can break. There's a little plastic piece in here that can break because it's just, I mean, it's just not very good. I mean, it's just not very good at all. And then they said something about the tube. It's plastic, so it could actually break on you. And the material in the strap right here is just, it's kind of flimsy. So just when you're looking at tourniquets, look at that red piece there and see what it looks like. If it has that middle dot, don't buy it unless you want training. If it doesn't have the dot, then you should be good to go, and it's probably going to cost you around 30 bucks for one. So I paid about 20, 25 bucks for 3. Well, I should have paid the 30 for one, and I would have been ahead because I would have had 3 extra nice tourniquets for that. So that's just a little lesson that I learned. It was after the fact that I learned that, but yeah. Okay, moving right along. These are not in my med kit, but I have them as spares to replace as needed. But I've got some trauma wound dressings, 6-inch. They kind of resemble the Israeli, but they're not Israeli. They don't have the Israeli cincher plastic piece on there, whatever they are. So they're just a big band-aid. Kind of like the U.S. Army pressure dressings, like right here. And then I have a big bag of extra gauze rolls. Each one's supposed to be 4.5 meters. So I've got extra gauze. And I figure gauze, you'll go through a lot more gauze than you will like an actual band-aid. You're going to need to wrap and, you know, stuff like that. This right here was a cheap IFAC that I got, but the problem is it takes so much. Oh, look at that. It comes right out. Anyway, it takes a lot when it's all packed up to get it pulled apart. And get to the things that you need on the inside. Now, strapped on the outside, I've got a couple of the U.S. military pressure dressings. And then on the inside, I just have some gauze, some gloves, and some smaller style dressings. I've got 4 extra dressings in there. and I've got some athletic tape, the type that sticks to itself, and I think that's it in this little IFAK. Yep, another set of gloves. So I got 2 pair of gloves in there. Yeah, that's it. I'm gonna shove these back in here real quick. Put one set on one side, another set on the other side. Athletic tape, and then I will stuff this back in its pouch later on because it can take some time to get it stuffed up in there. All right, now we'll move on to the bag. All right, we got 3 compartments here, 2 on the outside and one kind of biggish one on the inside. And out here I've got a couple of those trauma bandages. Did something fall? Yes, it did. All right, so I got a couple of those. I've got some 3.5 by 5.25 self-sealing sterilization pouch. And it looks basically just like square gauze to me. I've got another US bandage in there, some more athletic tape, some tape, waterproof, another one of those self-sealing sterilization pouches. It just looks like regular old gauze to me. This is an H&H compressed gauze. A sterile crinkle cotton fluff bandage roll. So, just another type of bandage. And then I've got 5 of these great big ones. It's 11 3/4 inch square. These are the ones that you would use on your belly or somebody's belly and cover up the wounds that are there. You know, any place that's big, your butt, your back, your stomach, your thighs, you know, any place that has a big wound or a big area of skin that needs to be covered up. So I got 5 of those. I got a couple little plastic straps in there. I think supposed to be for, I don't know. I think this is for that IFAK, but I got them in here for general purpose. And then I also have some pain reliever, 500 milligram. This basically your aspirin that you can get over the counter. Just got some of those. One of the things you might want to do is go ahead. I don't think these are open yet. Oh yeah, they are. Make sure that they're full and have some cotton or use some of your sterile your pads that can tighten that up a little bit and keep them from rattling in the middle of the night. They can probably, the sound can travel for a long ways. So that's one thing you can do. And that's it for this bag, or this pouch. Let me get this back in here and we'll move on to the next one. Okay. straps here real quick. And we'll move up here to the top one here. Uh-oh. Oh, I've got the bag caught in the zipper. Not the medical bag, but the little plastic bag. Uh-oh, I'm gonna have to replace that little plastic bag. Oh, shoot. There we go. Alright. What I have in here is a couple little boo-boo kits in here. They're just full of Band-Aids. Got some antiseptic in it. Some alcohol wipes. It's got a sting pad in it in case you get stung by something. Just some alcohol wipes, you know, for cleaning the area. And that's pretty much it for the boo-boo kit. And I got 2 of those in there. I also have some anti-itch. I guess the bag's okay. Some anti-itch in here in case somebody runs into something itchy, some kind of poison ivy or something. I also have some Ivorest, which is poison ivy spray. You just spray it on and let it dry on the itchy area. I've got Golf Pain Away, which I think is kind of like a little towelette. I think it's kind of like Bengay. You just take that and rub it on your, you know, whatever's ailing you. I've got a couple of these athletic ace bandage things in case somebody has a sprained ankle or a sprained wrist or something that can get wrapped up. Something simple. And some of those things can be pretty expensive. I have some chapstick in here. And I think there's a name for these, but it's basically a splint. And you can, you know, mold it however you need to. I broke my wrist, so you can stabilize. And that's it for that pouch. One thing I don't have with this, but I do have them, and they're in my battle rattle on my IFK in the battle rattle, and that's the shears. I don't have any medical shears for this, so that's one thing I need to make note and get me a shears for this pouch, or for this med kit. Put them there. All right. See if I can not get the bag caught this time. Oh, a plastic bag. There we go. All right, moving along to the inside. All right, inside I have a tourniquet. I don't think this one has a... Yeah, this one doesn't have a red deal on it, but this is one that I brought home from Iraq. It's got metal here. This is metal, so that's good. And then the material is just it's the SOF tactical tourniquet. Made in the USA, so it's got to be good, right? But yeah, the material's good. The Velcro's good. So this is a good tourniquet right here. Works the same as all the fake ones, but okay, what else do we have in here? We've got Tegaderm film, which is basically a band-aid with a window on it. It was something that I had, so I got it. Or I put it to use in here. I've got Meplex border, which is a big band-aid, big square band-aid. So this would be for like your maintenance, not something that is immediate or emergent. This will be for like you got your head wound 3 or 4 days ago, but you need to keep it covered, and that's what this would be. I've got more gauze. This is a 2x2, just square. I've got some of this gauze stuff that I had from a procedure I got. Had to do stuff here at home, and they give you so much of it, and I still had it, and it's just a tube gauze, which you could, you know, put your arm through it, or however you wanted to use it. Use it for packing a wound, you know, whatever you need it for. And I've got, there's another one of those tubes. I've got some round disc cotton pads. They could be used for, you know, alcohol, dip alcohol in it and clean a wound, whatever needs to be used. If you wear makeup, I guess you could use it for that. I've got 3 syringes in case you need to flush a wound or something. You can use water, alcohol, whatever you've got to flush a wound, or flush an eye out maybe. What do I got? Alcohol pads. These are, you know, for cleaning wounds, whatever you need them for, just alcohol wipes. More, this is kind of a cotton pad. I've got a sling in here. I wanna make some more, find some material, make some more, but I want to make another video, show how to make them, how to use them, do a first aid video sometime. So that will be coming up. Probably this winter I'll have time to do that. This was a little kit that I had. It just has gloves, just some medical stuff in it, you know, bandages, alcohol wipes. It was just in a kit. And then this is a securement device. It's just like if you had a IV or something, had hoses or lines on it, you just use that, put that on there, and it'll hold the lines and the IV in place. I had one of those. I don't have any IVs or anything like that. I'd have to get a lot of retraining for the IV, and probably civilian certified before I'd be able to IV somebody anyway. Let's see what else we got in here. I've got some 4x4 gauze. I've got, well, that wants to keep coming out. I've got a big boo-boo kit. It's got tape in it. It's got gloves. It's got an ice pack in it. It's got some more 4-inch gauze, bunch of little band-aids, alcohol prep pads, and this was antiseptic, and this one is antiseptic too, I believe. Non-aspirin. Oh, it's aspirin. Okay, so I got some more aspirin in here. What's this one? First aid burn cream. Okay, got some burn cream in there. That one. This one is a, what do I want to call this? It's Dyphon, but it's for hay fever, runny noses, stuff like that. I only got one of those. But anyway, nope, I got two of those. So anyway, I got a little boo-boo kit here. And then the last couple of items I have more of those little disc cotton gauze or whatever you want to call them. I got a bottle of rubbing alcohol. I've got a bottle of hydrogen peroxide, and one more package of those disc things. Another pack, 2 packages of those in there, and that's it. So, if you've had any medical experiences or anything like that, drop them down. I'd love to read them. Put them in the comments. If you have some ideas that I can expand on this, I mean, there's a lot of things I can add to this yet. This is Molly, so I can add pouches on the outside. I do have a little bit of room that I can stuff some smaller items, maybe more gauze, you know, things like that. Maybe some casualty cards, you know, things like that. I gotta do this. How am I gonna do this? Like that, I guess. That works. Put that back in there. Put this in there. All right. Okay, yeah, if you like seeing this stuff, you know, like all my other videos, hit that like button, hit the subscribe button, help me get out there, tell your buddies about me, tell me, hey, there's a new guy on the block, he's an idiot, go look him over. I had some guy the other night, had my first hater on YouTube, didn't like that I didn't have a script. Well, what kind of script do you need when you're showing gear? Now, you either like it or you don't. So, there's that. Oh, forgot my syringes. And that's it. I've got a little bit of room in here that I could put something else in here. Maybe I can put these two. Oh yeah, I can put these two back in there, and that takes care of that. So I don't have any excess now. So they're all in the med bag. I've got room for some other stuff, like maybe get some of that athletic tape that sticks to itself. They've got different sizes that I can get. I only have one size here. 2 rolls of it, but one size. That's really all I can think of tonight. So, with that, oh, my tourniquet. I'll put that away here in just a minute. So with that, let me go over my script. And you know who you are. Just make sure I've got it. Okay, I got everything I wanted to talk about on my script. My script, right here. You can see it. And with that, train as you fight, fight as you train.